Hi, I'm Dr. Malpani. I'm an IVF specialist, and I'm going to talk to you today about what you need to know when you go for a consultation with an infertility specialist. And the truth is, it can be quite unnerving having to go to a doctor for multiple reasons. Obviously, doctors are scary people. They talk very fast. They use a lot of medical jargon, so you don't understand half of what they say. There's a long line of patients waiting outside, so that half of what they tell you, you forget. They often use complicated terms and they assume that you're going to understand anything. And you're scared to ask questions because he's so busy, as a result of which the value which you can get from a consultation from your doctor often gets lost. And it's not just the doctor's fault, it's also, I won't say it's your fault, but what I'm going to try to emphasize is there's a lot you can do to make sure that the consultation becomes a lot more productive. Now the fact of the matter is doctors are busy people and you can't increase the amount of time which the doctor has. But there is a lot you can do to make more efficient use of the time which the doctor has with you. And the best way to do that is by doing your homework. So I'm going to walk you through how I do a consultation with an infertile couple who's coming to me for the first time. Let's start from the basics, and usually it's fairly straightforward. We first explain how babies are made. We then explain what the possible problems could be for anyone. And then we talk about what the possible solutions are, again for anyone. And then we focus on what we need to do for that individual couple. So let's start. We find it very helpful to use models because otherwise some of this stuff is very confusing because doctors use words like vagina, uterus, fallopian tube, ovaries. And quite frankly, lots of patients don't have a clue what the doctor is talking about. So we use a simple model just to walk you through this, just to refresh your high school biology. I'm sure this is the one chapter in biology you must have paid a lot of attention to because obviously everyone wants to know how babies are made, especially when you're a preteen or a teenager. But there's a lot of stuff you don't know, and a lot of the stuff you know may actually be wrong because you've never bothered to revalidate that information or you were too embarrassed to find out the truth. It's actually quite a big problem in India where sex education is never done properly. People are too embarrassed to talk about it, or people just assume that everyone knows. So here's a short walkthrough. And obviously, you only need 4 things to make a baby. And the reason I say obviously is that stuff which everyone knows, right? So what do you require? You require eggs, which is what the woman provides. You require sperms, which is what the man provides. And of course, that's not enough because the eggs and sperm need to meet in order to form an embryo. And that's where the female reproductive tract comes in. So this is what the inside of the woman looks like. That's the vagina, where you have sexual intercourse, where the sperm actually get deposited. Now, if sperm get deposited, most of them will leak out, and that's completely normal. But some of them will swim through what's called the cervix, into the uterus, then swim from there into the fallopian tube. And for 24 hours every month, that's called ovulation. And that's called the fertile time, and I'll explain a little bit more about that in detail. If there is an egg waiting here in the fallopian tube, the sperm and the egg will meet, it will fertilize, it will form an embryo which will then travel to the uterus. And if everything goes well, you have a happy ending, and then you have a baby after 9 months. So as I said, really, your requirements are very simple. You require eggs, you require sperms, you require fallopian tubes, you require a normal uterus, and you require that the sperm be deposited in the vagina at the right time. That's the basics about how babies are normally made, which means you need to understand a little bit more about ovulation and when ovulation occurs and what the fertile time is and how you can track that, and I'll do that in my next video. Meanwhile, if a couple comes to us and says, hey, we've been trying to have a baby, we've been having sex regularly for 1 year and we've still not got pregnant, that couple is labeled as being infertile. And that's when we start doing the test. So what's the first test you do? Never test the woman first, because it's a simple rule in medicine that you should always do cheap, simple tests first. So the first test we do is the test for the man. And this is what the man's outside looks like. That's the penis, that's the testis. And really the most important test for the man, we don't even need to do a physical examination, is a semen analysis to check whether his sperms are okay or not. This is critically important, and this is what the doctor does. And this is what sperms will look like under the microscope. They've got a head, they've got a tail, and there are lots of them and they're swimming around. Simple test to do, not a very expensive test to do, and actually that's a bit of a problem. Because it's not a very expensive test to do, lots of laboratories don't do it well at all. But let's assume you've gone to a good laboratory, you've done the sperm test and it's normal really, then you don't need to do anything else as far as the man is concerned. So let's assume the man's sperm count and motility are fine. And if they're not, I'll talk to you later on about what we need to do about that, but that's a separate video. So let's come back. Now you obviously need to start testing the wife. We prefer doing both the tests for both the partners together so that within a period of 7 to 8 days, we have all the answers we want. So we finish off the husband's sperm test and we test the wife. The wife's tests are fairly simple again. Not expensive, not complicated, you get quick results. There's really no reason why it should take so long to get to the bottom of the problem. And her tests are a simple blood test on the 3rd day of the period to check hormonal levels, FSH, LH, prolactin, TSH and AMH. And I'll talk to you a little bit more in the next video about what these tests are and why we do these tests, which will tell us something about her egg quality. And then we need to test whether a uterus and tubes are normal. And the simplest test for this is an HSG or a hysterosalpingogram to test whether the tubes are open, and a vaginal ultrasound scan, which will tell us if there is anything anatomically wrong with the uterus. Once we have all these tests, we can then come to a diagnosis. And once we've come to a diagnosis, we can come to treatment options. And that's what I'm going to be discussing in our next video. See you there. And if you thought that I went very fast or you couldn't understand anything I said, well, hopefully you understood some of it. But the good thing about a video is you can review, you can rewind, you can replay, and even better, all this information is available on our website. The website address is www.drmalpani.com. We've got over 1,000 pages of information and hundreds of videos which are designed for infertile couples like you to help you to have a baby. That's my idea of what I call information therapy. So please go to drmalpani.com, and if the information we provide helps you to have a baby, nothing will give me more pleasure, because that's the reason I became an IVF specialist, to help you to complete your family.